Hello, Assalam Alaikum. I hope you all will be fine. Welcome to my Iqbal World's YouTube channel. Today in this video we discuss about what is health insurance. So let's start the video. First of all, you click on your browser. When you click your browser, this page will be opened. You just click in the search bar and search what is health insurance. When you search what is health insurance, the website page will be opened. You just click in this first website, health insurance. When you click this website, the page will be opened of health insurance. What is health insurance? Health insurance is a contract between a company and the consumer. The company agrees to pay all or a sum of insured person healthcare and cost in return of the payment for a monthly premiums. The contract is usually a one-off-year agreement during which its insurer will be responsible for paying specific expenses related to illness, injuries, pregnancy, or a preventive care. Health insurance agreements in US generally come with the expectations to coverage including a deductible, a requirement of the consumer to pay certain healthcare costs out of pocket up to maximum amount before the company coverage begins. One more co-payments that require the consumer to pay a set of the share the cost of for specific services or procedure. Key takeaways: health insurance pay most medical and surgical expenses are prevented, care cost incorrected, and insured person is returned for the monthly premium payments. Generally, the higher of the monthly premium is the lower of out-of-pocket cost are the insured. Virtually all insurance plans have deductible and co-pay, but these out-of-pocket expenses are now capped for federal law. Since 2010, the Affordable Care Act is the prohibited insurance companies' form of denying coverage of patients with the pre-existing condition and allow to the children to remain off their parents' insurance plan until they reach the age of the 26. Medical, Medicaid, and Medicare and the children of the health insurance program (CHIP) are the federal health insurance plans that extend coverage of the older, disabled, and the low-income peoples. How does health insurance work? In the United States, health insurance is a tricky of the negative and the business with the number of the religion and national competitors who coverage pricing and the availability vary from of the state and even by the country. About of half Americans have health insurance coverage as an employment benefit with the premiums partially covered by the employer. The cost of the employee is the tax deductible and the peers and benefit of the employee are tax-free. With the certain expectations of the S corporation employers, try the Investopedia stock simulator. How to investigating learn how to trade the real time of our virtual stock simulator. Our platform help to search you and the right strategies for the building of the manifesting wealth. Self-employed people, freelancers, and a gig worker can buy insurance directly on their own. The Affordable Care Act of 2010, commonly called Obamacare and Medicaid of the certain of a national database called healthcare.gov, which allows to individual to search for a standard plans for a private insurance that are available where they live. The cost of the coverage are subsidized for the taxpayer and whose income are below for the federal poverty their land. And some, but not all states created their own variants of the healthcare.gov that are the trial for their residents. Retirees receive federally subtitles and care throughout Medicare and families who self-represent reported income where the lowest income backed up and the eligible for the subsidized Medicaid coverage. Types of the health insurance. Health insurance can be tricky and the negative in USA, so called managed care insurance and plans required policyholder to get their care from of the network of designed health care provider. If the patient seek care outside the network, they must be pay higher percentage of the cost. The insurer may be even to refuse payments outright of the services obtained out of the network. Many managed care plan, for example, health maintenance organizations and point of the services plan and preferred provider organizations, by the contrast, do not require referrals but do set a lower rates of the using network participating and the services. Insurance companies may be deny cover of the certain services that were obtained without a pre-resolutions, and they may be refused payment of the name, brand, and drug of the generic variants and the capable for the medicated is available lower cost. What are co-pays, deductible and co-insurance? Most of the health insurance plans require their customers and pick up form of the sum cost of their coverage is the various ways. First is deductible, co-pays, co-insurance and pocket maximum. Insurance plan with the higher out-of-the-pocket cost generally have a smaller monthly premium. When shopping for plans, weight of the benefit of lower monthly payments against the potential risks of the large out-of-the-pocket expenses in the cases of the major illness or accidents.